Good morning. I would like to thank you for giving me this opportunity to talk about something I really like to talk about, the health tourism, and how Egypt is offering itself as a new destination in the market for the coming years. So, health tourism in Egypt, past and future. I am Dr. Asad Riyad, General Manager of Egypt in Touch Assistance Company, Certified Assessor and Regional Office Manager of Temus International in Egypt. In the past, in ancient Egypt, illnesses were not just cured by magicians and the medicine men, but also by doctors and physicians. Excavations have revealed plates showing physicians and an illustration about Amenhotep, who was the physician to King Zoser, shows how he was worshipped as the god of the healing after his death due to the medicinal knowledge he possessed. In the period of the New Kingdom, medical prescriptions were very varied, and dozens of them were available for some diseases. The physician chose the most effective medicines based on the prescribed criteria. The age of the patients was strongly considered when deciding a medicine. Chemists had to be very carefully consider the age of the patients while preparing the drugs. What they have treated? Actually, a lot. They dealt with surgeries. In Edwin Smith's papyrus shows the suturing of non-infected wounds with a needle and thread. At least 39 mummies with cancer have been identified. Cancer of the uterus has been described in the Ebers papyrus. The surgical treatment of abscesses or cysts was described in the Ebers papyrus. Biles and rectal prolapse were treated by medication, suppositories, laxatives, and enema. And they treated also dental problems. Numerous papyri enumerates prescriptions to dental diseases such as pyorrhea, loose teeth, dental caries, and abscesses. Surgically produced holes to drain an abscess under the first molar were found in the mandible of the 4th dynasty mummy. This something was between 2625 to 2510 before Christ. A loose tooth fixed with a gold wire bridge to a neighboring sound tooth was discovered in another mummy of the same dynasty in Giza. Artificial teeth holding a maxillary bridge by a silver wire was also found in the late period. Tooth extraction, treatment of the mouth ulcers, and treatment of jaw dislocation were dealt with in the Edwin Smith and Ebers papyri. They also dealt with public health, mental illness, and psychiatrical disease. They also dealt with eye, face, and cosmetics, and they know about the heart and vascular diseases. This was in the old. So, what Egypt can offer now and in the future? Let us talk about what Egypt have at the moment as an infrastructure to be ready for medical tourism. A lot of airports now, mostly in main cities and touristic cities. We have hundreds of hotels and resorts. We are preparing for a law for the medical tourism. This will be the first regulations for the health tourism market soon. Thousands of kilometers of new routes has been paved during the last 10 years. We will not be able to forget about the weather, which is suitable whole the year, and the location. You can travel from most of the European countries and from Russia in 4 to 5 hours to be in Hurghada, in Sharm el Sheikh, and in Cairo. We cannot also forget about that Egypt is a beloved destination for Russians. We have a lot of Russians living, working in Egypt, especially in Hurghada city where I live. In Egypt, we provide multiple varieties of programs for medical and wellness tourism. We have the light medical services. This could be the dental, cosmetic, eye, LASIK, and so on. We can provide also a specialized, highly skilled services. We have also the long stay programs, including the winter time program that we launched last winter under the name of Warm, Fun and Save. We have also multiple different type of seniors program and special need programs in addition to the wellness and rehabilitation. Most of our current hospitals in Egypt are accredited either by the national accreditation body known as GAHAR or by TEMUS International, which is a German-based company accrediting healthcare facilities who are dealing with international patients, or by the JCI, the Joint Commission International Body. Hospitals sharing in these programs are multiple varieties, starting from the governmental, military, private sector. In Cairo, for example, you can find the International Medical Center, the Air Force Specialized Hospital, Egypt Air Hospital, Saudi German Hospital, Al Salam International Hospital, and other specialized hospitals. We can find the Children Cancer Hospital, which is known with the name 57357, Al Watani Eye Hospital, and in Aswan we can find Dr. Magdi Yaqub Heart Center. We can find also Dar Al Uyun. This is an eye care hospital, Rufaida Maternity Hospital, Dar Al Fuad Hospital. In Alexandria, a lot of hospitals also are present, starting from chain of Andalusia, in addition to the newcomer Elite Hospital. And in Hurghada, we can find El Gona Hospital, Nile Hospital, Asil Medical Hospital, Red Sea Hospital, and many others. Some new hospitals now are coming to this market under the name of the new National Insurance Program. You can find Al Nasr Hospital in Portside, Aziz Maternity Hospital, and Ismailia Hospital, and others in Luxor. In Sharm el-Sheikh, we can find also the Sharm International Hospital, plus South Sinai Hospital. Those are examples of hospitals which are working, and we have actually many others. I don't have enough time to enumerate all, but of course we can find them everywhere. I can send a list of that. If we talk about wellness tourism, Egypt has more than 1,000 locations distributed all over Egypt, have multiple varieties of natural wellness resorts which can deal with many medical conditions. And by the way, this is still need a lot of investment, and I am kindly inviting also our experts here and there to have their own branches or investment in similar places like this in Egypt, which has the advantage that it is working all the year, not only during the summertime. A lot of opportunities is still present. We are welcoming our friends from Russia to invest and to work, and also to have the treatment in Egypt. For any inquiry, for any information needed, please feel free to contact me. Thank you.